Hey, hello everyone. Thank you so much for joining us for our webinar this afternoon, your precious lunch hour. It's much appreciated. This is a webinar from the Feminist Communities for Climate Justice project called Feeding a Change, Healthy, Affordable and Sustainable Food for All. And we've got a really good lineup of speakers for you today, discussing the topic of food poverty and food justice. So let me just get my slides to go. There we go. So here is approximation of our running order. As you can see, I'll be talking a little bit, just introducing the project. Then Sive O'Neill, our project lead, will speak a little bit about kind of connecting the patterns and kind of the broader overview of the issue of food poverty and especially how it connects to climate change and climate issues. And we'll then hear from Lauren Corbett of the Liffey Partnership, then Mavis Ramazani of Cooking for Freedom, then Jenny Lyons of the Cultivate EU project. Finally, we'll hear from John McFadden of Empower. And then if we have good time, we'd love to have a good Q&A session with you all. So just briefly going over the Feminist Communities for Climate Justice project for those who might not be familiar with the project itself. The Feminist Communities for Climate Justice project is a joint initiative between the National Women's Council and Community Work Ireland. And really what we hope to do at its core is to increase the capacity of community workers and grassroots communities and people all over the country in changing the conversation about climate change from one that is maybe very removed from people's lives, very scientific, people feeling like they have to have a degree or a specialization, into a different conversation, really connecting climate change to social justice and social inequality issues in Ireland, and making sure that people can connect it to issues in their everyday lives like housing, health, transport, and food, which is what we'll be talking about today. And so kind of the four key aims of the project are to amplify the voices of women and marginalised communities most impacted by the climate crisis. We know that those who have put the least greenhouse gases into the atmosphere that are causing climate change will be the most impacted by climate change. Despite this, they're often people in our society who are already disadvantaged or socially excluded and lack the resources to participate in the green transition or to recover from a loss of maybe their home or their business in the aftermath of something like a storm or a flood. We also want to advocate and influence policy with women and marginalised communities. Again, those groups who are disadvantaged or socially excluded, the ones who are mostly impacted by the climate crisis, tend to be missing from our decision-making spaces where climate policies are drawn up. And so we want to make sure that those voices are properly represented in the policy conversation. We also want to mobilize communities to support and learn from one another. And we do that with our Feminist Communities for Climate Justice National Network. We're at over 160 members now, and that's open to individuals, organizations, academics, NGOs, anything, community groups as well. And really, what we want to do is create a space for people to learn from one another, to talk about the climate crisis and maybe this new way that we're proposing, attaching it to social inequality issues. And we also have a number of working groups within that network, and it's one of the best ways to get involved in the project and the project's work. And then finally, a big piece of our work is strengthening the capacity and raising the consciousness of those working with or active within women's and marginalized communities. So that largely community workers, but we also mean anybody kind of active within their communities, any kind of facilitators that are trying to start conversations around climate change with communities who might be most impacted by it. And we've done this in two ways. Last year in 2024, we ran a QQI Level 7 certificate course with the Department of Applied Social Studies at NUI Maynooth called Community Work in a Changing Ireland. And we ran that for 20 weeks to upskill a group of activists, community workers, and climate people interested in climate initiatives with the skills to talk about community development, climate justice, and feminist approaches. And just last month, we released two toolkits specifically to help communities and community workers and any kind of facilitators to have conversations and build their own knowledge and capacity in talking about the climate crisis as a social equality issue. And so why the project came about is it was a direct response to community workers who knew that climate impacts were coming, but needed more information, guidance, and tools to talk about the climate crisis with these communities that they are working with. We're also responding to data and policy gaps, noting that existing climate policy does not adequately pay attention to the domestic and gendered impacts of the climate crisis. And also in response to the membership of the National Women's Council, who wanted a feminist analysis of climate justice and also wanted climate justice integrated into the council's work. And just a few of our outputs. I already talked about our certificate program and our network, but we also did a piece of work with the School of Applied Social Studies in UCC in Cork, where we produced a baseline report called the Feminist Climate Justice Report, which you can access on the National Women's Council website. And a number of other areas, our policy advocacy, our webinars, such as this one, to raise consciousness and awareness of the climate crisis as a social inequality issue. And we are also planning on running a campaign towards the end of this year to talk about climate justice in different ways, from a bottom-up and participatory way based on feminist and community development principles. But now I'm going to hand over to Sive O'Neill, who is our project lead in the Feminist Communities for Climate Justice project, and she will be talking about linking all of these pieces together. So Sive, take it away.
Thanks very much, Vanessa. It's wonderful to be here. This is our first webinar looking at the issue of food systems and food poverty, and it's a new departure for our project. So what inspired us to actually take on this topic, which is a huge issue, obviously? Well, many of you might recall that in 2019, a very controversial report was published by the Eat Lancet Commission recommending transformation essentially in food systems and diets to ensure that the food system could respond to the climate challenge. And it produced dietary guidelines that recommended dramatic reductions in the intake of red meat, especially in developed countries where there is an association of that type of diet with all kinds of health impacts. And it was quite controversial at the time and quite heavily criticized for not being culturally appropriate to certain parts of the world. And many of the industry lobbyists also challenged the recommendations, saying that higher levels of meat and dairy products should be permitted and could be sustainable. So after that criticism, the Eat Lancet Commission went back and they did a further 6 years of research and peer-reviewed studies looking at those criticisms. And they recently, last week, published an updated guidance on what counts as a sustainable healthy diet, which they now call a planetary health diet, because it's supposed to be a diet that's good for human beings, but also good for the planet. And they reconfirmed their recommendations from 2019. So no change to the recommendations on lowering our meat consumption. But the difference is that they took on very much the criticism that they had to address the question of food justice and ensure that the dietary recommendations they made were culturally adaptable, affordable, and plant-rich. So next slide, Vanessa, please. So what do we know about food systems and climate change? Well, it's not going to be much of a surprise to hear that, unfortunately, the environmental and climate impacts of food systems are really very severe and are increasing, over a third of global gas emissions originate from food systems, from the cultivation of land, right through to the disposal of waste food in the environment. And food systems generally, which is the whole of the supply chain, are exceeding 6 of the 9 planetary boundaries. And obviously, that is a really critical situation. But environmental health and human nutrition issues are inextricably linked. So we can't just turn a page and fix this easily. It's going to require changes throughout food systems, especially given that 2 to 8 billion people on the planet cannot currently afford a healthy diet at all. So if we cannot make this planetary health diet affordable, then it is not going to be possible to make these system changes. And in addition to that, the report that Eat Lancet came up with noted that people involved in food production often don't get properly paid for this work. They don't get a minimum wage. And in many parts of the world, food producers struggle to get access to land or legal rights over land that they are farming. And there are some issues around that in Ireland as well. And there's also obviously questions about livestock emissions. Livestock are major greenhouse gas emitters and are driving land use change. So converting land to pasture that might have been originally forestry, and that is leading to biodiversity loss. So these are critical issues that we have to address. And if you look at the diagram there, you can see that we're in the top right-hand quadrant, Europe and Central Asia, not as bad as North America, but not anywhere within the safe and just space that the scientists are saying we have to be if we're going to kind of marry all these different goals. Next slide, Vanessa, please. So the purpose of the webinar today is really to begin a conversation about the challenges and barriers faced by women in marginalised communities in adopting these sustainable, healthy diets. How can we, looking at the issues through a feminist and climate justice lens, identify and respond to food poverty? Because our work in this project is about amplifying and empowering women in marginalised communities, and not preaching and delivering dietary recommendations that people are not in a position to follow. But the reality is that communities are already responding to the affordability and the health crisis. And we're going to hear from some of the panelists today who are going to talk about the work that they're doing. Nobody claims to have a quick silver bullet for any of these issues. So we're here to explore the possible approaches we might take. And in doing so, we need to involve food producers and growers and people involved in other parts of the food system, so that we can collectively redesign a local, a healthy, and a sustainable food system that's accessible and affordable to all. So with that, I'll pass back to Vanessa and we'll kick off with our speakers today. Thank you.
Thanks so much, Sive. I'd like to now introduce Lauren Corbett. So Lauren is the Community Food and Nutrition Worker at the Liffey Partnership in Ballyfermot. This is a relatively new and non-kind of clinical role, which is addressing poor diet and food poverty in the community. So Lauren, you're very, very welcome, and thank you so much for joining us today.
Good morning, everyone. Thanks for having me here. So following on from that, my presentation covers the key findings of a community needs analysis we carried out in 2024, which was funded by the HSE Sláintecare initiative. Just to say that disseminating the research is really crucial to us. You know, a lot of research is just done for research's sake and not really actioned. So we consider these spaces really important, and thanks again for inviting me. I'm going to try hard to stick to my time, so I think we'll have a Q&A at the end. So next slide, please, and you can go to the next one again. Perfect. So just for a bit of context, the area is a Sláintecare Healthy Communities site. For those of you who aren't familiar, these sites are located in the most deprived areas in the country. I suppose the community would grapple with things like unemployment, educational disadvantage, high proportion of people with disabilities, chronic illness, high proportion of lone parents as well, and then some other difficult social issues at play. I suppose the study we conducted was a chance to kind of systematically evidence what we had a felt sense of on the ground already, and particularly since COVID-19, and then exacerbated in recent years by the cost of living crisis. In particular, we wanted to take a look at kind of a macro level of the food environment and how that was helping or hindering people's capacity to feed themselves well. Next slide, please. So our methods were quite comprehensive, but just quickly as an overview, they began with an evidence review. So a lot of the literature on this topic comes primarily from the US and the UK. So we would have kind of taken a deep dive into that, and this would have informed our study design. We mapped out the local food environment. We did a shopping basket survey to assess the affordability of healthy food. And then we carried out a series of surveys and focus groups to just add context and qualitative data. So 600 people were consulted altogether during this process. Next slide, please. So the full report has more detailed maps, but just in summary, I suppose you could consider Ballyfermot or Dublin 10 as both a food swamp and a food desert. The southwesterly region marked there by yellow hatch markings, that can be defined as a food desert based on the literature, because the nearest supermarket is over a kilometre away. So that's considered, outside reasonable walking distance. In that area in the southwest, there's about 11,000 people living there in Cherry Orchard, and there's only 3 small convenience stores. So obviously I always caveat, I'm like, we've nothing against convenience stores, but we all know that they tend to offer a limited range of, healthy food, particularly fresh food, and usually sell things at higher prices as well. And then conversely, another definition taken from the well-established literature is a food swamp. So if anyone's familiar with Ballyfermot, the middle area on the map there indicates that the main row of shops, like the town centre, can be considered a food swamp. And that's basically because there's an abundance of takeaways and convenience stores, which are marked by red dots, and they can be classified as unhealthy outlets in comparison to grocery stores or supermarkets. We plotted the schools, which kind of indicates a particular set of problems. So all the school campuses are within 17 to 9, within a kilometre of 17 to 19 takeaways. So I suppose what we're saying is, like, this situation is not unique. It's actually really hard to find an example of a healthy food environment. I've been looking looking hard for one, but I suppose, this is an example of where social inequity, poor urban planning, and a broken food system kind of together make it extremely hard for people to sustain themselves well. Where you live shouldn't define how well you eat, but based on our series of focus groups for people in Cherry Orchard, particularly the inaccessibility of the supermarket makes strategies like bulk buying, for example, really difficult. A lot of people are relying on public transport and have mobility issues as well. We also found from our conversations with people that the food environment was really pushing certain food choices onto people, particularly young people and parents. And the community has an overall sense of broken promises in terms of getting the infrastructure that they need. And next slide, please. So we carried out a local shopping basket survey. This was modelled off Safe Foods periodic study. And essentially, it revealed that a nutritionally adequate shop would cost between 114 and €209 weekly, depending on the household type. For families relying on social welfare, this would consume at least 33 up to 45% of their income, clearly highlighting a significant issue with food affordability. And again, these findings are very transferable. You know, social welfare rates don't change and food prices don't change across the country. So we're confident that this is not unique and that the same findings would be apparent elsewhere if it was examined. And next slide, please. So given the challenges, you know, it's unsurprising we found a very high prevalence of food poverty in Dublin 10, 43%, whereas the national average is 9%. We also found that it disproportionately affects those already facing social exclusion. 86% of travellers, 53% of ethnic minorities, and 52% of people with disabilities were experiencing food poverty. So ultimately, that highlights this as a big social justice issue. Next slide, please. A very stark finding from the research was that 1 in 4 people, so a quarter of people in this community, said they'd gone a whole day without eating due to a lack of money in the previous month. So that really is quite shocking, particularly like, you know, we're supposed to be one of the wealthiest countries in the world. So it's kind of unbelievable that this is happening. Next slide, please. We did an investigation into the barriers to people eating well and found that affordability, particularly food prices, a lack of income, and competing bills were the predominant challenges, followed also by some access difficulties like carrying heavy groceries without a car. A comment that really stood out to us from one of the focus groups was, we know what's good for us, but it's another thing getting it and affording it. And, you know, that really stood out to us, and we felt that it captures the mistake we make, particularly in like kind of traditional health promotion, where we focus too much on individual education and skills development related to food or cooking or nutrition or budgeting, without addressing the real structural and societal barriers that lead to food poverty in the first place. So, you know, thinking about, we focus too much on behaviour change as opposed to systems change. And next slide, please. The report mapped out existing local food supports. There is a food bank in operation in the area. There's a community garden, and some local agencies offering ad hoc crisis support like hampers or vouchers at certain times of the year. The services demonstrated a strong sense of empathy for their clients, but they regularly cited limited resources and an inability to meet demand. We found that there was low public awareness of services. Services were heavily oversubscribed, and also client stigma came through as a very significant barrier to engagement. Next slide, please. We want to really emphasize that people we spoke to are not passive, but demonstrate a lot of strength, resourcefulness, and resilience as they make huge efforts to feed their families, such as skipping meals to feed their children, batch cooking, and walking miles for better value. Food poverty is not about apathy or a lack of understanding, but about active survival in a challenging and unjust system for people with many competing life demands. Okay, next slide, please. In light of the findings, we propose several recommendations across three themes. So affordability, availability, and accessibility of food, including forming a multi-agency food alliance and looking past mere emergency food provision towards more long-term measures that address income inequality and create a health-promoting food environment. Since the report's launch, I suppose I've been trying to switch gears and think more in terms of solutions. And, what could a healthy food environment look like here in Ballyfermot? Networking has revealed many exciting models like community kitchens, co-ops, and grow your own projects, urban food forests, and communal pantries or fridges, which would provide support without falling into a stigmatizing charity-based model. The current challenges, I suppose, are getting decision makers around the table and grappling with the problem's systemic nature, which I'm sure all you environmentally minded people can relate to. It's difficult to define effective socially just solutions without compromising environmental sustainability or devaluing food. For instance, initiatives like surplus redistribution via the likes of Food Cloud are very popular, but sometimes criticised for absolving the supermarkets of their responsibility and providing subpar produce. Ultimately, solving the core issue requires a universal shift in our entire value system around food, ensuring farmers aren't left to wear the cost, while moving past that, good food shouldn't be exclusive, nor should it be cheap or free. So I think there's a balance to be struck between making it accessible to people, but also not undermining the producers or their products. So I think I need to wrap up because I'm going over time, but ultimately the findings are quite stark. Sorry, you can go on to the next slide. The reality that nearly half of the D10 community is impacted by food poverty and a quarter are going days without eating due to a lack of money should really outrage us and spur us into action. And really, this is just the start of the process for us. And there are many existing projects to inspire us. I would be more than happy to share the full report or the summary report with anyone that would like to contact me for it. So thanks for listening. That's me.
Thanks so much, Lauren, for a huge amount that you managed to get into just a small amount of time. So thank you very much. And if you want to share the report link even into the chat, then all of our participants can take a look at it. So this is a sustainability impact reporting specialist with a passion for community-driven initiatives and regenerative food systems. With an entrepreneurial background in culinary arts and food studies, Jenny brings a unique, grounded perspective to measuring and communicating the social, environmental, and civic impacts of grassroots food initiatives. She currently works as a research assistant on the Cultivate EU project at Trinity College Dublin and manages the development of the Sharing Solutions platform. So, Jenny, thank you very much for joining us today.
Well, thanks so much for having me here. Yes, if you could just go on to, yeah, brilliant. You've got my slides there. So I'm Sustainability Impact Assessment Lead here in Trinity College Dublin in the Geography faculty, which is project lead for this Horizon Europe project called Cultivate. And we are Cultivate EU because there is actually another Cultivate.ie here in Ireland. So important to get that one right. If you go to the next slide, please. And I'll whip through these, so you have to be quick on your trigger finger. So just a little about Cultivate. We're a 4-year project, halfway through the project, just over halfway through. And the objective is really to nurture this transitions that you were speaking about in your introductions, Sive and Vanessa, towards more just food systems, raising awareness about food sharing initiatives, which are the initiatives that Lauren mentioned on the ground in Liffey Partnership. Therefore strengthening sustainable food sharing. Next slide, please. You could go to the next slide. Oh, perfect. Back one or two. That's great. So we are, as I said, in the replication phase of the project. We have already done the activation in 3 hub locations, which were Barcelona, Milan, and Utrecht. So got to see some incredible work on the ground from food sharing initiatives who are facing these challenges that were mentioned in the introduction to the webinar. The Cultivate is very aligned, I suppose, with the Feminist Communities for Climate Justice, aimed in terms of amplification, advocacy, mobilization, and capacity building. In that, food sharing initiatives are being co-designing the tools that we're developing. So they're the cultivators that you see on the first point there. And what we are doing is the objectives of the projects are supposed to enhance knowledge and awareness of urban food sharing and its effect on society, the environment, and the economy, to advance and reinforce food sharing economies in these urban and peri-urban communities, giving a more sustainable, resilient local food system and supply chain. And Cultivate is going to also be providing studies that will help in the prevention and decrease of food waste. You can go to the next slide. Thank you. So what we're doing is developing an online platform with 5 key tools, and I'll just quickly go through the tools in the next couple of slides. You can go on to the next slide. So the menu of good governance is a decision support tool being developed for policymakers and shapers. So to help that piece that's often sticky that Lauren mentioned, getting people, decision makers around a table, this should aid in that challenge. To the next tool, a library of citizen engagement. So like the Feminist Communities for Climate Justice project is often faced with what can we do? We want to help. And, Vanessa developed and the team developed 2 toolkits. In a similar vein, the Library of Citizen Engagement gives a whole repository of strategies for people who want to advance food sharing in their local communities. Next slide. And then a community of practice so that this knowledge can be exchanged across Europe during and beyond the project. And then I'll just go on to the next 2 tools, which are we're developing here in Trinity College Dublin. So the food sharing map, which is developed from a database, which it catalogues and maps and tracks and monitors food sharing initiatives in all the cultivated cities and possibly beyond after the project. And this tool is used in conjunction with the one that I am leading on, the Sustainability Impact Assessment tool, which makes up part of the food sharing calculator. So this is a tool for understanding the impacts that FSIs create, as well as identifying the kind of investments that will be needed. So that part is being developed as we stand, as is currently. The SIA tool is actually already developed and it is open for people to utilize for free. So it's online on the Sharing Solutions platform. If you go to the next slide, you can see if you want to access the tool shed, which is this what we call the sustainability impact assessment. You could actually scan the QR. You could pause the webinar if you're watching it back. You can scan the QR code and you'll get online to the tool shed, which means that you can go through, enter in your data, go through qualitative data if you don't have lots of numerical data, and this will generate a report of your sustainability impacts, and enable you, even if you're a very small initiative like a community garden, for example, you'll be able to produce a report of your impacts. And it's this kind of network of initiatives that is really interesting. And what we're doing at the moment is utilizing the map and the SIA tool in tandem to produce citywide or city scale impact reports. So that's what we are working on currently. And Vanessa has anticipated my move to the next slide. And so in this city scale impact assessment, we're gaining these insights on social, environmental, governance of impacts from food sharing, scaled up to city level. So we have published a project deliverable on that, which is available at the link there. We're currently working on a pilot report for Dublin, and it's food sharing impact, and it's just a baseline estimation from a limited number of food sharing initiatives. But it's really important to have this evidence base because it provides this starting point from which we can map, track, monitor these impacts from the network of food sharing initiatives in the city over time. And it also demonstrates where FSI impacts align with existing policies, including national and local and international measures, for example, identifying progress towards the SDGs. This gives a kind of a concrete way of mapping impacts against the Sustainable Development Goals. Vanessa, you can move on to the next slide, please. So yeah, I rattled through all of those. And if you do have questions about using the tool, if you are a food sharing initiative, please sign up, register on the platform, and I will approve you. And you can use that tool to demonstrate your impacts. We'd be delighted for people to do so. So yeah, please do get in touch with that. And thanks, Feline. That's me.
Thanks very much, Jenny. A huge amount of content in quite a short amount of time, so fair play. I'm really delighted to reintroduce everybody to Mavis Ramazani. And Mavis is the founder and chairperson of Cooking for Freedom, and she's also a lover of people and food, a community builder, a mother, a mentor, an employment specialist, an advocate for women and children, and a proud global citizen. So Mavis, thanks so much for joining us, and please do take it away.
Thank you so much, Vanessa, for inviting me and the team and for having me this afternoon. Good afternoon, everybody, wherever you are joining us. Thank you for taking the time. My name is Mavis Ramazani, and I came in Ireland through the international protection process. I live independently now, but I still support families still living in international protection accommodation who are here as refugees, whether through the process as international protection applicants, having their own status, or from the temporary protection beneficiaries. So I support that community. It's my community. Food poverty in Ireland, it is created because in Ireland, we have food everywhere. So Cooking for Freedom supports families, adults, and children living in emergency centers who do not have cooking facilities. We find community kitchens and are very grateful to different community centers who've offered us their space for free, where I organize every week for families who are here to seek sanctuary, to leave the emergency center to go and prepare their own food. I would like to see an island where this food poverty is addressed by having access to the kitchen from day one for everyone who comes to island through the international protection process. We all come from homes that have a kitchen. We've prepared our own food at a very, very young age. So now when you come to island, you find yourself in a hotel where food is prepared for you. For me, I think that is heartbreaking, that is sad, because wherever people are accommodated, adults and children, there's one thing we all need is to eat. At the beginning of the day, at the end of the day, no one can prepare food for you. You can only prepare yourself nutritious food. We all know how important food is for our physical health, for our mental health. And right now there are thousands. When I say thousands, I mean thousands of families living in emergency centers across Ireland. At a walking distance from most of us, there is a hotel that is housing people in Ireland who are here to seek sanctuary. We are not visitors. We are here to stay. We are here to contribute, to be part of Ireland. We are part of Ireland. So Cooking for Freedom at a very small scale, we're trying to build that bridge where we find the kitchens and individuals go in and prepare their own food. If you come in the kitchen, the impact is immediate. Imagine leaving an emergency center, going and buying your own food, the choice of buying your own food, access to the kitchen, and actually preparing your own food. We all eat the same rice, the same potatoes, but we prepare it differently. And we all have a right to access a cooking space where we can prepare our own food. It doesn't mean someone who comes in Ireland to seek sanctuary is different from an Irish person. They are not different. We are all, they're all young people, adults. I think Lauren took some words from me, and I agree with Lauren that we need system and structural changes, because one of the trauma-informed ways of welcoming people who come in Ireland to seek sanctuary, the fact that you've opened your borders, you have welcome, is to give access to a cooking space, and then access of where to receive that food. There are different places where food is available, but it is not accessible to people seeking international protection. We all know how much individuals, adults and children are earning. They're all earning less than 50 euros a week. And we all know how much a basket of food costs. So if you're earning less than 50 euro, how is your mental health? How is your general well-being? It is a future problem. Food as well builds communities. Food connects people. Food is one language that we all understand, and it should not be taken away from anybody, from any community, because food builds communities. I continue to say that. And it also, for someone who's here to seek sanctuary, helps the process of healing, helps the process of overcoming years of trauma. So for me, food justice, for people coming to seek sanctuary in Ireland is access to cooking facilities from day one, the actual kitchen. We are not talking about food, because food I can knock at anybody's door in Ireland, like where I come from. If we don't have a salt in my home, I know my neighbor is there. The same in Ireland. Food is available, but access is a challenge. So that is food justice for me, is to see access to cooking facility wherever a child, an adult is, who is here to seek sanctuary. I have been advocating for years, because when you come to seek sanctuary, it's temporary vulnerability. At the end of the day, we are global citizens. We are citizens that bring diversity, that bring so much goodness in Ireland. But how you treat us from the beginning affects our health, our mental health. That means we will not be able to fully contribute into society. My dream, my hope is one day Cooking for Freedom can be given a space that we can have a kitchen in there, a fully equipped kitchen, so that families can come in. With my hope again is have a space where parents can bring their children. We have pregnant women, we have mothers with babies. And that dream coming true of having a building that belongs to people here in Ireland to seek sanctuary, it will be a dream come true. It will be food justice. So I have shared my links, and I'm available on different social media platforms. Please connect with me and see how can you support the work that, as Cooking for Freedom, as a team of volunteers, we are doing. It is great work. It is impactful work. It is kindness, showing kindness to each other. And we can extend that to everyone, where everyone, again, has access to cooking facilities with no excuse. Because the excuse, oh, they are in a hotel, they cannot cook for themselves. But what is the difference? It's a home, it's their home. It's up to individuals controlling that environment to make the decisions to say, we have families who've experienced a lot of trauma. We need to give them access to a place, to a space that they can prepare their own food. From food sharing, conversation starts. From conversation, we build communities. From building communities, we share what we have as communities, whether it's from a community garden, whether it's from different food banks that are there. But it's a step. The first step is access. Without access, we are already hindering the community building, because we are giving adults and children frustration when they do not have access to cooking facilities. Imagine in particular for a mother. A mother has to feed her own children. A father needs to feed his own children. That process we can't stop it. It's a learning, it's a loving, it's a caring process. So I just want to say thank you so much for affording me this opportunity to talk about the work that we do as Cooking for Freedom, and hopefully we can make a difference together. Thank you.
Thank you so, so much, Mavis. I think a really incredibly important contribution to hear in the conversation on this topic. I'll just cut through a few slides here and I'll introduce our final contributor, John McFadden. So John McFadden is the Senior Community Development Worker at Empower, which is the local development company for Fingal. He has over 15 years experience in youth and community work and has an MA in community and youth work as well. He is passionate about social justice and equality, and his work covers food poverty, climate justice, grassroots community development, and integration, amongst many other things. So thank you very, very much, John. You're very welcome.
Thanks very much. And can you hear me okay? Yeah. Yeah, thanks for having me. And maybe just to introduce to say that uh, Vanessa kind of invited me along today. We provide food provision in Fingal and have done for a couple of years. But we are, I guess, reflecting on that and looking at introducing a new program over the next kind of couple of months. And I guess this was a bit of an opportunity to reflect on kind of some of the challenges that we've had and what we kind of hope to achieve with the new kind of program. As Vanessa mentioned, we're Empower as the local development company for Fingal. Our main funding is through SciCap, and so we have a priority target groups. We work a lot with traveller, Roma, new arrivals, and one parent families. But we also work with a range of other groups and people across the area of kind of Fingal, so people with disabilities, older people, younger people, long-term unemployed, and all sorts of combinations of the above and more. And I guess this is relevant in terms of who accesses our food bank, and as was mentioned kind of earlier, when we started the food bank kind of initially, I guess it was an emergency relief kind of response, but I think we had no idea of the scale of the need kind of in the community. So you can move on. So like I said, we mostly work out of two areas, Balbriggan and Blanchardstown. So these would be the two kind of denser urban areas, kind of high deprivation index levels. We don't have specific criteria for our food banks, but a lot of the people who would access them would fall into those high priority kind of target groups. And then we have our mission statement there, which I'm going to kind of come back to a little bit and reflect on in terms of the different models that we're trying to kind of introduce. But obviously the overall approach is around our community development kind of approach, so the brave advocacy, the climate action, the anti-poverty measures. So you can move on. So again, just to say, so our current provision, so it's two food banks. I'm very conscious that it's not a homogenous thing. Lots of people run different food banks different ways. You can see there, so there's a very high number of families that get a weekly sort of service. We have then kind of, I guess, other local community groups that we support, and a kind of special project sort of piece around kind of Christmas time sort of as well. The food comes from Food Cloud, and I guess that fits in with our climate approach in the sense of food sustainability, and we also have food that comes then through kind of food for some of the staples. The model that we have kind of run, so it's food provision with sanitary products. It has a case management approach, but because of the way it's set up, the physical building, the numbers of people that are supported, it's very much a signposting sort of service. So where need is identified, people can kind of signpost it to whether it's for money management or wellness supports or employment training, different kind of things like that. So those are the provisions that are currently in place. If you want to move on to the next slide, then. So some of the challenges that we've kind of identified are why this model isn't working in terms of lifting people out of poverty. So again, it's been touched on by some of the other contributors, but how people find themselves in this need is complex. It's structural, so the lack or the poor public transport infrastructure, and the lack of childcare, and particularly kind of public and affordable childcare, mental health difficulties, there's no end to the list of kind of challenges that are kind of out there. What we have found, and I guess, this concept that a case management system, you know, transitions people out of kind of food poverty is very difficult. So most of the people that access our current food banks are very complex cases. So individuals with addiction, homelessness, experience of domestic violence, disability, and multiple intersectionalities of all of these kind of things kind of operating the whole time. And the idea that a signposting or some kind of gentle support, I'm going to say, isn't going to work in a very fast sort of way. So I suppose in kind of recognizing sort of this, and then actually just one of the other logistical kind of barriers in terms of the kind of healthy food sort of piece is, our current kind of food banks don't have access to fridges, so there's a shortage of in terms of the fresh food kind of piece sort of as well. So you can move on to the next slide. So our new model is going to be a social supermarket. So again, not a homogenous thing. Certainly lots of different ways of operating them. And they're quite a common sort of thing in the north of Ireland. But increasingly there's versions that are opening up in the south kind of as well. So I'm not a perfect model by any stretch kind of either, but I guess there's a couple of key differences that we wanted to kind of emphasize in terms of what this new model might kind of provide. And the key one is about that change from the sort of case management signposting to be a more intensive and community development approach, so that the outcome would be more of a long-term empowerment. It won't necessarily mean moving people out of food poverty, instantly or anything like that. But it's just to commit to the approach kind of maybe a little bit sort of more. So there's a couple of, I guess, the process kind of changes. So it's a time bound sort of piece, and there's a small nominal kind of cost involved. But mostly it's to create what's a more authentic shopping experience for people. So more like the idea of having your own trolley, picking what it is that kind of you want, and that obviously then allows for a slightly more kind of culturally appropriate sort of piece, reduces the stigma, and is a more dignified, I guess, kind of a approach sort of to it. There will still be kind of some restrictions in terms of, kind of, I suppose, balancing, the sort of staple and the luxury items kind of in people. So different social supermarkets manage that, I guess, in different ways. And again, the detail of how we will kind of do it. But, we're looking to have something where people can kind of, I guess, fix that balance a little bit themselves. So they'll sort of maintain that autonomy. And then so I suppose the downside or in some ways of this newer model is that we're going to look at a much lower caseload, so it'll be a much more intensive kind of support. So the idea that and we're really lucky the physical building that we're setting up in is our child and family hub. It's a much more relaxing kind of space. It has the fridges, but it's a space that people can kind of come and sit and move away from that kind of transactional sort of feel, our traditional kind of food bank maybe had, and like that. I suppose what we wanted to move towards is, the idea of a wraparound sort of services. So you can move to the next slide. So again, it's just to look at, I mean, they don't necessarily need to be within kind of Empower, but there is the plans to kind of set up a lot more of the kind of food support. So the Healthy Food Made Easy is our kind of cooking program, and family and parenting kind of supports. They'll all be kind of based in and around the sort of same space. Some of the parent and toddler and the family social prescribing. So all of these services that Empower can kind of provide and feel kind of more connected to. But also when we are signposting that there's just more of a relationship and more of a connection with our community development kind of staff and the people who are accessing the social supermarket. The vision to just make it a little bit um, more around kind of the change and create opportunities where people can kind of get into that brave advocacy space of looking at kind of maybe some of the structural pieces that have created the sort of problem and working with us to address kind of some of those. That's it.